I can be audible, right?
Yes, we hear you, sir. Hi, sir. Good morning again.
And and you can't see my slide yet, can
We
you?
can, sir.
Not
We can see your
you
slide.
can, you can. So I'll just enlarge it.
So consider this a teaser for the audience so you know what Doc Nick will talk about later.
Okay, am I ready to talk now?
Yes, sir.
Okay, good morning, everyone. I can see some familiar names in our group of attendees, and I'm glad to see all of you. Some of them are my patients, actually, who are willing to learn from me and from the nephrologists and the neurologists as well today. Thank you, Solo, for that kind introduction. Today is World Hypertension Day, and we celebrate this every 17th of May yearly. And this is the reason why we are doing this as our participation in St. Luke's Global to commemorate World Hypertension Day. I am tasked to talk about cardiovascular complications of hypertension. Being a cardiologist, Solo has mentioned this earlier. High blood pressure is called a silent killer because it usually has no symptoms. And it's funny that sometimes patients say that I have headache because my blood pressure is 130 or 140 and I cannot tolerate that. It's actually the other way around because normally and typically blood pressure or high blood pressure does not have any symptoms. And sometimes the symptom of headache, neck pain, back pain, chest pain may actually be the one causing the blood pressure to rise. Sometimes, I may have to say sometimes. Okay, hypertension is a global health crisis and it affects about uh, 1 in 4 men and 1 in 5 women. Unfortunately, about 50% of our hypertensive patients are undertreated or don't have their blood pressure under control. And the problem is uncontrolled hypertension dramatically increases risk of heart attack, heart failure, stroke, and kidney failure, among other things. The good news is if you decrease your blood pressure, if you're hypertensive, and decrease it by at least 10 millimeters mercury, there is actually a 20% reduction in overall adverse cardiovascular events, 13% reduction in mortality from dying, 28% reduction from developing heart failure, 27% reduction from having stroke, and coronary heart disease about 1.7%. So a 10% reduction is very significant. So any effort to bring down your blood pressure, please do so. Okay, this is the new category of blood pressure. Normal blood pressure is less than 120 over 80. 120 to 129 actually is now classified as elevated blood pressure. And diastolic of less than 80 is actually considered elevated blood pressure. We used to think that 140 is high blood pressure. Now, 120 to 129 is considered elevated blood pressure. And the new classification for high blood pressure, and this is shared by both the European Society of Cardiology and the American Heart Association, is 130 to 139 is already called stage 1 hypertension. 130 over 130 to 139 over 80 to 89. And stage 2 hypertension is anything more than 140 over 90 or higher. So this is now the new classification in contrast to the previous JNC classification, JNC7. So what happens for those of you who are not very familiar, what happens when we have blood pressure measurement? What we measure as systolic pressure is actually the pressure in our blood vessels when the heart is pumping. And what we measure as diastolic blood pressure is the blood pressure in the arteries when the heart is relaxed. So you have 120 systolic over 80 diastolic as our normal blood pressure. This is how a normal artery pulsates. It depends on the pumping activity of the heart. It pulsates together with the pumping of the heart. So what happens when our blood vessels dilate? There are situations when it's very, very warm. Sometimes when you take a little bit of alcohol, that's why you become flushed. When it is hot, when you are standing for a prolonged period, this is what happens. Our blood pressure our blood vessels tend to dilate. And what happens if you have uncontrolled blood pressure or if you have the presence of high blood pressure? There is a tendency for our blood vessels to vasoconstrict or to become narrower. And this increases the workload of the heart. And this is how some complications start. What are the causes of high blood pressure or hypertension? There are so many. It can be genetic, it can be behavioral, depending on our lifestyle. It can even be environmental, or it can even be caused by socioeconomic and psychosocial factors. The more important ones and the ones that we see in the clinic actually are due to hormonal mechanisms, kidney mechanisms, neural mechanisms, and sometimes vascular mechanisms as well. So we have categorized hypertension as either primary or secondary. Primary is the most common. It's more than 90+% of all blood pressure. We also call this essential hypertension. Associated with essential hypertension, meaning it's not due to anything else, would be aging, family history, high salt diet, excessive alcohol consumption, lack of physical activity, being overweight, or sometimes stress. The other less common causes of hypertension would be what we call secondary hypertension. And this may be related to kidney disease, adrenal gland disease like tumors, some medications, sleep apnea, or stopping breathing at night, those of us who snore heavily and would stop breathing, hormonal disorders like thyroid diseases, and narrowing of the arteries. Now, we've mentioned this earlier. These are lifestyle things that may cause blood pressure to go up. Now, how do we measure blood pressure? This is very important. There are three ways that we measure blood pressure. One is when you go to the doctor's office. That's called office blood pressure. And as doctors, we have the responsibility to measure this properly. Some patients would complain that their blood pressure when they arrive is actually still low. But after waiting too long in the doctor's office, blood pressure starts to go up. Then you need to pacify these patients, make sure that they are relaxed, use a validated device, don't make the cuff too low, make sure that the patient is seated, feet on the floor. We shall discuss it later. And then obtain further BP if there is some discrepancy. During the first visit, usually, we need to take the blood pressure on both arms. So if you are visiting your doctor for the first time, please remind your doctor, doctor, aren't you supposed to take my blood pressure both on the left and on the right, just to make sure that there is no substantial difference. The other way of measuring blood pressure is through what we call ambulatory BP monitoring. In situations where you have white coat hypertension, every time you see your doctor, every time you are in the doctor's clinic, blood pressure is always high. The doctor may request for a 24-hour ambulatory BP monitoring, which is hooked to you for 24 hours or at least minimum of 16 hours. The beauty of this is that it is not related to the possibility of white coat hypertension. And it also may measure blood pressure during sleep. And normally our blood pressure when we are asleep should also dip or be low. And for patients whose blood pressure do not dip at night, then this may be a problem that may lead to other complications. The other accepted blood pressure monitoring system would be what we call home blood pressure monitoring. And this empowers the patient now to be able to monitor his blood pressure accurately as long as you do it properly. And later on, I will describe to you how to take your blood pressure at home accurately. Now, there are several classifications of blood pressure. We mentioned non-elevated blood pressure, which means an office blood pressure less than 120/70, home blood pressure about the same, and ambulatory BP of about the same. Office blood pressure, we may have a little bit of allowance because of that element of white coat hypertension. So it is a 120/139 or diastolic of 70/89. And that is the elevated blood pressure. Home BP, a little bit higher, a little bit lower than the office blood pressure, 120/134. And hypertension is classified based on these three levels. Office blood pressure of 140/90, blood pressure at home of more than 135/85, or ambulatory BP monitoring, which is very similar to home BP monitoring of 135 over more than 85 diastolic. So this is how we should check blood pressure at home. For those who smoke, don't smoke for 30 minutes. Don't take alcohol. Don't take your blood pressure within 30 minutes after exercising, because all of these may actually falsely elevate your blood pressure. Take 3 to 5 minutes rest before taking your blood pressure. Make sure that the cuff is the right size, which allows to slip a finger between the arm and the cuff when deflated. You can try this if your finger cannot slip between the cuff and the arm. That means it's too tight. Or when your finger is too loose within the cuff, then that means you may not be able to measure your blood pressure accurately because it's too loose. Ensure that the spine is upright, so sit erect, and the feet are flat on the floor. And measure the blood pressure multiple times daily for the most accurate readings and ranges. Take at least 2 readings every time to ensure accuracy. Now, a lot of patients would ask me, is digital monitoring accurate? Well, there are accredited or devices that have been calibrated, and the Philippine Society of Hypertension actually has recommended some of these, and you may check it online, which brands are accredited by the Philippine Society of Hypertension. Complications, this is my topic today. It can involve any artery. Artery supplying the eyes, artery supplying the brain, which Christian will talk about later, artery supplying the kidneys and the kidneys itself, large and medium arteries, small arteries, and particularly the heart, which is the topic assigned to me today. So complications of hypertension include both heart failure and heart attacks as the major cardiovascular complications related to this silent disease. So what happens when we have high blood pressure? It damages the inner lining of the blood vessel supplying our heart, which is called the coronary artery. Now, if this is damaged and cholesterol forms a plaque within this artery, there is a tendency for this cholesterol plaque to be unstable. And if it ruptures, it causes a heart attack. And when this ruptures, blood clots can be exaggerated in its formation, because law of nature says if there's a wound, then there should be clotting. But the clotting, when someone gets a heart attack, is so exaggerated that it occludes, or it covers almost the entire blood vessel, causing no flow to your heart, giving you the typical chest pain that patients with heart attack experience. When someone is having a heart attack, it's very important that you be brought to the emergency room right away. ECG is taken within 10 minutes. You are brought to the cath lab immediately to be able to open your artery, and most of the time put a stent like a scaffolding to restore blood flow to your heart. The other big very serious complication of uncontrolled blood pressure is heart failure, because the heart will now have difficulty pumping into the big blood vessels, and under normal blood pressure, the ventricle was stretched to fill up and contract to pump. But when we have uncontrolled blood pressure, with the ventricles reduced in size, less blood is pumped out of the heart, and the thickened, rigid ventricular walls reduce the size and volume of the ventricle. And this leads to less blood being pumped out of the. And the symptoms of heart attack are as follows. You have shortness of breath, you have rapid heartbeat, sometimes coughing, maybe heart failure rather. Coughing may be a sign of heart failure. Sometimes it may have chest pain, nausea, or appetite loss, frequent urination at night, feeling of fatigue, leg and ankle swelling, and unexplained weight gain. So that is heart failure. So sometimes patients ask me, what's the difference between a heart attack and heart failure? So heart attack means there is complete blockage of your blood vessel. supplying your heart, involving the coronary arteries. This usually presents as chest pain, sometimes can be seen on ECG or blood tests. Heart failure, on the other hand, is more of a clinical symptom of shortness of breath because there is not enough blood being pumped into different parts of the body. So how do we control blood pressure? Salt reduction is very important. Exercise is important. Losing weight, healthy diet, and moderation in alcohol intake. Now, this is a chart that says that for each category, you can actually expect some significant drop in blood pressure. For instance, on the first column, we see here weight loss leading to decrease of 5 millimeters mercury in your blood pressure. A healthy diet as high as 11 millimeters mercury, and this is without taking medications. Reducing intake of dietary sodium or salt is about 5 or 6 millimeters drop. Enhanced dietary potassium intake, which you can get from fruits and vegetables, about 5 millimeters mercury. Physical activity, aerobic, dynamic, or isometric resistance, about an average of 5 millimeters mercury. And reducing alcohol intake, another reduction about 4 millimeters mercury. So it is very important that we change our lifestyle in order to control blood pressure. Of course, if we cannot control blood pressure with lifestyle alone, there are several medications. And the recommendation of both the European Society of Cardiology and the American Heart Association is to start you first with ACE inhibitors or angiotensin receptor blockers. The ACE inhibitors would be medicines that end with pril. The angiotensin 2 blockers are those that ends with sartan. The calcium channel blockers are mostly those that end with dipine. And sometimes, if you cannot control this, you may be prescribed a little amount of a diuretic, something that will make you pee or urinate a little more than the usual in the form of thiazide diuretics. And you will see in this chart that it's not exactly the same for each patient, and there are specific subsets of patients that may benefit from different classes of medicines for hypertension. But in general, these are the first line therapies. There are second line therapies, and sometimes you may even use beta blockers or stronger diuretics, or sometimes potassium sparing diuretics in particular situations as like a second line therapies. So your doctor does not just choose any drug that is being promoted by the MedRep. It has to be tailor fit into what you need. And again, continuation of second line therapies for blood pressure. So treatment options, as I've said before, would be based on the specific subset of patients and their clinical conditions. Now, before I end this first part of the lecture, let me try to answer the frequently asked questions about hypertension. When is the best time to take one's blood pressure? Do I need to take medicines right away once diagnosed? Do I need to take BP medicines for the rest of my life? And do these medicines have adverse side effects? Is home BP monitoring reliable? At what level should I worry? And are there other options aside from lifestyle change and medications to control my blood pressure? So this is the most recent recommendation from the European Society of Cardiology, which says, and when we say class 1, that means it is a must, and everybody agrees that this is effective. It is recommended to take medications at the most convenient time of the day. It doesn't have to be specifically morning, afternoon, or evening. Most medications now are long-acting, so you may take them at the most convenient time of the day. And this is to establish a habitual pattern of medication taking to improve adherence. To answer the other question, in adults with elevated BP, elevated pa lang, ha? Which means between 120 to 129, you may try lowering your blood pressure with lifestyle measures to reduce the risk of cardiovascular disease. And in adults with elevated BP and high risk, meaning they may have diabetes, probably family history, or there may be, unfortunately, smoking, after 3 months of lifestyle intervention, so you give them about 3 months. This is not hypertension yet, elevated pa lang. BP lowering with medications may be recommended for those with confirmed BP more than 130/80. Medyo mababang threshold compared to before. and this is to reduce cardiovascular disease risk. It is recommended that patients who are actually diagnosed to have hypertension already with confirmed BP of consistently more than 140 over 90, irrespective, irrespective of cardiovascular risk, lifestyle measures, and medications should be initiated promptly in order to reduce the risk for cardiovascular disease. It is also recommended to maintain BP lowering drug treatment lifelong. So hindi pa pwede yung pag gumanda na yung blood pressure, then you stop the medicine, even beyond the age of 85, if well tolerated. Remember, those who are frail, 85s and above, may be very sensitive to medication. So these are patients who need to be monitored more closely. And I'm talking about this in cases where BP lowering treatment is poorly tolerated, achieving a target of 120 over 129 may not be practical, so it is recommended to target a systolic BP that is what we call ALARA, as low as reasonably achievable. Home BP monitoring, yes, it is recommended and it is encouraged that you self-monitor to achieve BP control, and it has been shown that self-measurement, when properly performed, can have positive effects on the acceptance of the diagnosis of hypertension, patient empowerment, and adherence to treatment. So, tackling how to tackle difficult to control high blood pressure like hypertensive emergency versus markedly elevated blood pressure, resistant hypertension, and other modes to control blood pressure will be the topic that I will talk about later after the two discussions by the neurologist and the nephrologist. So for now, thank you for listening. Back to you, Solo.
Thank you, Doc Nick, for that informative discussion. Nabitin ako dun. Yung pinaka-highlight, yung yung how to control BP. Those are the questions patients usually ask about what do I do when I have very high blood pressure. So for those who are in the audience, do wait for that topic. Okay. So also, by the way, for the audience, if ever you have questions, do make use of our Q&A chat box.